All right, let's talk about community nursing. If you're a nursing student, you know this is a huge mental shift. You go from focusing on one single patient in a hospital bed to thinking about the health of an entire community. It's a big leap. So today, we're going to bridge that gap. We're going to zero in on the clinical logic, the why behind every single action, so you can walk into your exams feeling totally prepared.
So here's our game plan. First, we're going to look at the big picture, this thing called the health pyramid. Then, we'll become detectives and dig for the real root causes of health problems. After that, we'll look at all the different hats you'll wear as a community nurse, learn how to basically give a neighborhood a head-to-toe assessment, and then, you guessed it, we'll put it all to the test.
Okay, first things first, we have to build our foundation. We're starting with the health pyramid because you have to understand why population health is the bedrock that literally keeps our entire healthcare system from collapsing. If you get this one concept, I promise everything else we talk about today is going to click into place. This slide right here, this is the core mindset shift you have to make. We're going from bedside to curbside. See, at the bedside, your focus is almost microscopic, right? It's one patient, one illness. But at the curbside, you're pulling out the wide-angle lens. You're not just seeing one person with a flu, you're scanning the whole community for patterns. You're looking for the very first signs of an outbreak. And here is the absolute bottom line. It's prevention that keeps our hospitals from being totally overwhelmed. Just think about this quote. Imagine a building. If that foundation, all our prevention efforts, starts to crumble, what happens? The top floor, our hospitals, and our ICUs, it's all going to collapse under the weight. And this whole idea is perfectly visualized in what we call the health services pyramid. And here it is. Look at how this is built, from the bottom up. That massive base, that's population-based stuff, things like clean water, sanitation, immunization laws. This is what keeps huge chunks of the population healthy from the get-go. But when that base fails, you don't just get a few sick people. You get ERs flooded with patients, and the whole system gets overwhelmed. That tiny little tip at the top, the ICU and acute care, it is completely dependent on how strong all those levels are below it. Okay, so if that pyramid is built on prevention, the next logical question is, what are we preventing? To figure that out, we have to become detectives. We have to look upstream to find the real root causes of illness. And a lot of the time, those causes have absolutely nothing to do with what happens inside a clinic. So this is the official definition of social determinants of health, or SDOH. But forget the textbook for a second. I want you to picture it like this. Instead of just treating the same kid for an asthma attack over and over and over again, you become a detective. You look upstream and you discover the root cause. The kid lives in an apartment full of toxic mold. That is the real problem you need to solve. Now, this is a huge, huge point for your exams, so listen up. It is so easy to label a patient non-compliant. You know, their blood sugar is always high, they must not be taking their insulin. But the expert nurse, the community-minded nurse, stops and asks the tough questions. Does this patient even have a refrigerator to keep their insulin in? Can they actually afford the copay for this medicine? It's almost never about being lazy. It's about not having the resources. Always, always assess before you assume. So let's put this into practice right now. You've got a patient who is homeless, just diagnosed with type 1 diabetes, and you're about to send them out the door with insulin that needs a fridge. What is your absolute #1 priority? This is basically a Maslow's hierarchy question, right? You have to secure their basic needs first. So before you teach them how to inject it, before you talk about complications, you have to figure out how they can realistically and safely store this medication. Sometimes looking for those upstream factors leads you to really serious safety issues, like suspected abuse. And in this situation, these steps are non-negotiable. #1, above all else, is to secure privacy. And the rationale, the why behind this, is critical. A victim is not going to tell you the truth if their abuser is sitting right there in the room. You have to get them alone to ensure their safety. All right, so we've talked about what you're looking for, from mold in an apartment to safety at home. Now let's talk about who you need to be. In the hospital, your role is usually pretty defined. But out in the community, you have to be a chameleon. You're going to wear a ton of different hats, and your exams will absolutely expect you to know which one to put on and when. I want you to think of this table as your playbook for the exam. When you're the epidemiologist, you are Sherlock Holmes, magnifying glass out, hunting for the source of a food poisoning outbreak. As the case manager, you're like an air traffic controller for a patient's healthcare, making sure nothing falls through the cracks. And as the change agent, you're an activist. You're the one lobbying the city for a new sidewalk to keep older adults from falling. That column on the right, those are your exam keywords. Okay, quick check. You see a spike in an illness at a school. You start digging through records to find the source. Which hat are you wearing? The keywords are right there, screaming at you. You're tracking the incidence of a disease. You are being an epidemiologist.
All right, you know your roles, but how do you actually diagnose your patient when your patient is an entire community? Well, you use the same skills you already have. You perform a head-to-toe assessment, but instead of a person, you're assessing a whole neighborhood. This is probably your single most powerful tool, because you can't fix a community's problems if you don't know what they are.
So a good community assessment always breaks down into these three parts. First, you look at the structure, the physical place, the buildings, the roads, the parks. Then, the population. Who lives here? What are their ages, their health issues? And finally, the social systems. What's here to support them? The schools, the clinics, the bus routes. And that first piece, the structure, you can start assessing that one without even getting out of your car. I really want you to picture this. You're in your car, you're driving slowly through a neighborhood. This is your windshield survey. Your head is on a swivel, you're scanning. You notice the peeling paint on that old apartment complex. That's a potential lead hazard. You see toddlers playing way too close to a busy street that has no crosswalk. You see sidewalks that are cracked and broken. These are all vital signs for the community's health. Okay, we've built a pyramid, we've looked upstream for root causes, we've tried on all our different nursing hats, and we've done our windshield survey. It's time for the final checkoff. Let's pull all of these pieces together and see if we can apply this knowledge. But before that final question, let's do a super quick recap. If you remember nothing else, remember these 4 things. 1, the entire healthcare system stands on a foundation of prevention. 2, never, ever label the patient non-compliant before you assess their resources. 3, know your roles. Are you tracking, coordinating, or innovating? And 4, your community assessment always has 3 parts: structure, population, and social systems. Okay, here it is, your final challenge. Let's connect all the dots. You're doing your windshield survey, that's your structure assessment, and you see 2 things: old apartment buildings and lots of little kids. Based on just that information, what is the #1 priority secondary prevention, meaning screening, that should pop into your head? The answer is B. If you chose organizing a blood lead screening event, you absolutely nailed it. You understood the clinical logic perfectly. So let's just quickly break down why that is the right answer. And this just brings everything we talked about full circle. You started with a simple observation about the environment, the structure. You immediately connected that to a high-risk population, which was the toddlers. And then you chose the correct intervention, screening, which is secondary prevention, to catch a problem early. That right there, that's how you master community health.